we know that there's a lot of studies out there that demonstrate that the combination of MR and ultrasound for a fusion biopsy has been suggested to be more accurate than the traditional ultrasound-guided biopsies that have been used traditionally. So the issue is that a lot of the studies that have looked at this in various populations, whether it's patients that have never had a biopsy before, patients who have had multiple negative biopsies, or patients even that have had a previous biopsy and want to get an accurate assessment of their disease prior to entering, say, active surveillance, a lot of the studies were small, focused, and not really uniform when you compare the different ones. So at UCLA, fortunately, we've been performing these biopsies since 2009, and as a result, through last year, we had 1,000 men who had undergone this procedure, which represents, one of the largest groups of men that have undergone the procedure at an institution in the country. So we want to take advantage of that large group of men and really assess to see how well that fusion biopsy can help diagnose high-grade cancer in that patient population. So basically that was the impetus of the study, and our objective was to use that large cohort to find out how often men were diagnosed with Gleason 7 or greater, which is considered to be more aggressive or high-grade prostate cancer. So that was the objective of the study. And in terms of what we found, there was a number of interesting findings. First of all, we basically just were interested in looking at the distribution of abnormal lesions in the prostate, because those are the lesions that are noted on MRI that are actually targeted by the biopsy, in addition to a mapping biopsy which it samples the other areas of the prostate which don't necessarily have any targets. So all men had both of those done together. We found that about 3/4 or 76% of the men had at least one lesion that was noted on the prostate. And about 1/4 of them had what we would call determined a negative MRI. There were no suspicious lesions, okay? So that was the first thing of interest that we noted among the group. We then wanted to assess the relationship between, say, various clinical factors of the patient, their age, how large their prostate was, or their PSA level, and to see how those clinical factors related to the presence of higher grade cancer, Gleason 7 or greater cancer. So we found among the 1,000 men there was about 30% or 301 men had Gleason 7 or greater cancer. Increasing age and increasing PSA values were directly associated with an increased risk of finding this high grade cancer.